good.
Long time
Regular
no see.
insulin. Okay, huh?
Long time no see. Why didn't you come to the party yesterday? It was so much fun.
Wait, hold on. I'm in the needle. You have to
I'm so sorry. I'm so sorry. It was such a crazy night last night. I was knocked out like a patient in 328B. Did you smell him? He stinks. Do you know what he has? I don't know. But listen, I'll talk to you later. Just go do what you're doing.
All right. I'll talk to you later, all right? Okay, so 316B. Okay. Hey, what? Do you have the chart for 318B? I needed to transfer an order.
318?
Yeah, 18B.
No, I don't see it.
Did you check over there? No.
All right, I'll check later.
Yeah,
All
check
right, no
there.
problem.
So 318. 318B. Oh, okay. Hi.
Hi.
I'm your nurse, Naifa. And how are you doing today?
Good.
Okay, so I'm gonna give you medication, all right?
Okay.
What's your name?
This the
I'm sorry.
No, don't forget party tonight.
All right, I got you. Did I ask your name? I did, right? Oh, I'm gonna give you medication, all right?
Okay.
Okay, you're done.
Oh, okay. What is this medication for?
Insulin, because your blood glucose was high, so you're diabetic. I give you insulin.
But I'm not.
Are you sure?
Yes, I'm sure.
So I'm gonna check your chart. Okay, I'll talk to you later.
Okay.
Okay, so 15 minutes later, the patient faints and is found on the floor. An incident report is not filed, and a code was called, and the hospital was eventually sued.
Okay, so what was happening?
Medication error.
Medication wrong?
Discussing
There's so much going on.
Disruptive.
And y'all was talking about the patient all loud in the hallway.
Wrong room. Wrong room, wrong page.
Very good. So how could we have done to prevent this from occurring? Anybody have an idea? Anything you can do to prevent this?
should have just said, I can't talk to you right now.
So later.
Right.
Okay, we're going to talk about all the things we could have done to prevent this. First, I'm going to define what disruptive behavior is. The American Medical Association stated that personal conduct, whether verbal or physical, that affects or that potentially may affect patient care negatively constitutes disruptive behavior. So some examples is yelling or making excessive noise, like you see me before. I'm talking so loud in the hallway, everyone can hear my business about the party last night. Bullying, work violence, personal work, or calls on the unit, like someone who's looking up their, account balance and they forgot to pay the bill.
Instead of a drug.
Yeah, instead of a drug, or they're looking at Facebook, or making jokes or unprofessional comments in the workplace, like about the stinky patient. None of your business. Okay, can you guys think some cause of disruptive behaviors? Do anyone have
There should be
any
no
idea?
pros in this fucking video.
Yeah. Okay. Me neither.
Alright, so problem with the medication errors related to the disruptive behaviors. And I'm gonna talk about how can they be minimized. Usually, the first thing is you have to be careful because many medicine-related adverse events occur frequently and can be lethal. So just think about you forget to ask the patient if he has an allergy to the penicillin, and you give him the medication. The antibiotic. They has penicillin in. So the patient will develop allergies to it. So you need to be careful about that. The another two most common errors is needle stick injury by sharp instruments or objects, and the other one is wasting medicine. We're gonna look at case studies. The first case study you can see is preparing 2 insulin injections for different patients without laboring immediately. Sometimes it's because somebody's talking to you and you don't pay attention about that, and you just doing it. And later, how do you know which insulin is go to which one if you don't label it? And the case 2, when you check the doctor's order, and if somebody's talking to you or you are disrupted by your coworkers, and you just didn't catch a mix that look like some medication, first one is the Diprovan and the Diflucan. The first one is general anesthetic, and the other one is antifungal. Do you think that's the same? They will be the same. Yeah, that's the And the second one is the Prolosec and the Prozac. The first one anti-ulceration, and the other one antidepressants. You can see more information from the website www.isnp.org. how can the errors be minimized? So you guys all talked about that already. So I'm gonna give you more. First, you just don't interrupt a nurse who is preparing a medication injection, and wait till she finishes. That's the biggest one. And double check the patient's name. I did a double check, right? And then I just talk to myself, and that's not correct. You have to also check the medication's name, the dosing, like five writes and 3 checks. You always have to before that. And the medicine should be prepared for only one patient at a time. That's why you see the nurses just moving the car, on the hallways. All meds should be clearly labeled with the patient details, including the name of the medication. I didn't label my medication when I give it to my patient. And the high-risk medication should be checked with the other nurse and sign on the prescription chart. And the last one, medication should be checked against the drug and the prescription label.
Okay, the other issue with disruptive behaviors is possibility of HIPAA violation. So, like I was in the hallway, I was talking about the stinky patient in room 328 and what he had. If she did answer me, it was none of my business. I'm not taking care of that patient. Why am I asking? So, not only is talking about patients and their cases cause the hospital to be sued and me eventually to be sued for violating HIPAA, but it also affects the patient and the nurse-patient relationship. When patients start talking to you about their personal information, it's kind of hard for them. And once people know about their secrets, they make themselves vulnerable. And they're always wondering, what is this person thinking about me because I have HIV? Or what is this person thinking about me because I have cancer and I'm dying? I don't want them to treat me any differently. So when they do tell you something, we have to make sure that we don't tell anyone. And if we do, and the patient finds out, we lose their trust. And how that affects our practice then is that now they don't trust you because they know you're going to go down the hall, make a joke about it. And the patients in the room where I'm talking is going to hear about it and be like, oh my God, patient room 328 has C. diff. Oh my God, that's disgusting, or whatever. Or the patient has HIV, stay away from him. It's not right. And then the patient is not going to tell me any other previous history that he hasn't told me because they don't trust me. So now that makes my job and any other healthcare professional who has talked about them hard to help them out because they're not telling the full truth. Even verbal abuse can be a HIPAA violation because you can be verbally abused using stereotypes or discriminating against their religion, their where they're from, their age, or the disease they have. It's not right, and that's just ethically not right. And you never know, so try not to, and I know a lot of people do this, they go in the elevator, they talk to their friends, oh my God, today I had this patient and this happened. You don't know who's in the elevator with you. And even if there's no one in the elevator, you shouldn't be talking about patient information. It's hard for us to say, don't get close to your patients, and we do, we get emotionally attached, especially those who go into this field because they love patient care, they want to make a difference. But towards the end of the day, this is a professional job, and whatever happens that day after you leave, it has to stay on the floor, stay there. You can't repeat anything that was done or any patients that you had or any information. Because you never know, family members may be in the elevator with you, you're talking about this, and all of a sudden they can come to your face and say, why are you talking about my family? You don't just have to say their name. Even if you say the patient in this floor, not even stating the room, this floor had this and this and this, the family knows my patient, my family member had that. So don't go around and expecting. And I've seen a lot of multiracial marriages. You have Asians marrying African Americans marrying Hispanics. You don't know who's married to who, so don't judge.
Documentation be the big one. Her medication, she didn't check anything, and the incident report wasn't filed, so that's a huge issue. That should have been reported right away to the head nurse, the supervisor, or whoever's in charge. And the medical record is the most credible evidence in legal proceedings. So the hospital was sued. They didn't check anything. She didn't write what happened. And failing to notify the nurse in charge and not filing it can lead to legal issues. If you're on a plane, no one's bothering the pilot, right, when they're taking off or landing, right? So why can't they do that when the nurse is preparing medications? You know, the nurse can say, you know, don't disturb me at this point, you know, let me finish this first, and they can take care of that. It wouldn't lead to a problem this big. And so what can we do to prevent this from happening? Communicate. Have a meeting with the floor, with your nurses, with staff, you know, what we can do about this. And the Joint Commission, they have this code of conduct that describes acceptable and unacceptable behaviors and what to do if they do breach it. You know, there should be consequences. And the hospital, they should implement a zero tolerance policy. If anything happens, you know, you're suspended, you're fired, or whatever the case may be. And you should address the issues promptly and professionally to take care of this.
Okay, so now I'm gonna talk about another aspect that's gonna disrupt the nurse work, that is noise. Many people tend to ignore this fact, but it is a big issue in the hospital. So here is a chart of the main noise sources identified hospital staff. We can see that the visitors cover 66% and the patients covers 23%. So for the visitors who speak really loud in patients' room or in the hallways, we as nurses, we can just verbally remind them that, can you just please be quiet? There are patients in the room. And then for the patients, the data shows that patients tend to sleep well in a single room, not in a shared room, because their neighbors tend to speak really loud on their cell phones, so they have sleeping disruption by their neighbors. And for the rolling equipments in the hallways, like the procedure carts, we can just fix or replace the squeaky wheels. That will be helpful. And for the mental chart holders, like when you put the chart on the holders, it can cause some sudden noise that can wake up some patients. So to prevent that, we can pad in the chart holders. Okay, so why we do a lot of things to prevent noise in hospital? Because noise has a negative impact on both patient and the staff members. So for nurses, as a hospital staff members, high level of noise in hospital can potentially contribute to stress and burnout in hospital staff. And we tend to express this kind of feeling to our patients or to our family members. And then noise also have negative impact on speech communication, like in the role playing, when I was telling Maihua about my name, but Samin was talking to her, so Maihua didn't hear me. Okay, so noise in hospital also can cause medication errors. Okay, so noise control in hospitals remains a continual challenge. So we as nurses have to try our best to minimize the noise level in hospitals. So not let them to interrupt our work. So that's it. You guys have any questions? Any questions? That's it.